All right, are we live and ready to go? Fantastic. Hi, folks. Welcome to the Aging in Place Working Group, the 21st Century Caregiver Workforce Issues Subgroup meeting. Quite a quite a lengthy title. I thought what we do is I'm Senator Colin Benini. I'm here and a chance to introduce my co-chair and various others. What I thought we would do is everybody just give us a real quick. Everybody who's on the meeting this morning, just give us a quick introduction of who you are and what brings you here, either personal interest or professional interest, and then I think we'll move on to sort of a general discussion of what are the core issues we're going to be addressing, and then slowly sort of focus on what the future will provide for this subgroup. So I'll go ahead and start if that's okay. First of all, Caitlin, please wave your hand. Caitlin is running this show. And she's fantastic, and Katie's going to introduce herself in a minute. She's the actual knows what's going on. She's the important co-chair. So I am Senator Colin Benini. I represent the 16th State Senate District, which is just south of Dover down to the Sussex County line. So Magnolia, Frederica. For those of you in Newcastle County, we call it wave through country. You wave as you drive your way to the beach, but it's a wonderful place. I've been in the General Assembly for over a quarter century. Was fortunate enough to be elected pretty young, thank goodness, and I'm really looking forward to coming up with some concrete recommendations for an issue that I think is just critical for the future of Delaware. So first of all, thank you everybody for taking the time, and thank you for your willingness to help with this. And I'll go ahead and defer to my co-chair, Katie.
Great, thank you so much, Senator Benini. And very small world and very Delaware. I actually also live in the Senator's District. So I too am a Kent County resident, and I love it. It's beautiful. I love living here. But I'm Katie Macklin. I'm the Senior Director Advocacy with the Alzheimer's Association Delaware Valley Chapter. I've worked with the chapter since 2007, so I've been doing this work for a long time, but it's certainly something that I feel incredibly passionate about. And I also know that there's a huge need here in our state of Delaware. With our growing aging population, unfortunately, along with that is a growing incidence of Alzheimer's and dementia. Right now, we estimate that there are about 20,000 Delawareans who are living with Alzheimer's disease. But we also know there's a number more who are living with some form of dementia, Alzheimer's being just one form of dementia. But we also know that dementia doesn't only significantly impact those who have it, are living with it, but also significantly affects family caregivers, the family members. It can exact a significant emotional, physical, financial toll on family caregivers. And I am a full believer in public policy. That's one of the reasons I love getting to do what I do at the Alzheimer's Association, because I believe it's through the enactment of policies that we can truly influence change and reach the masses of people who are impacted by dementia. So I'm really excited to be a part of this effort because the workforce is a critical component to quality dementia care, but it's also really important that we're supporting those family caregivers as well. I also feel like I'm sort of coming full circle with this work because I went to graduate school at the University of Delaware, and my thesis was all on building a robust health professional workforce to address the needs of an aging population here in our state of Delaware. And so I'm excited to be coming, back to this work in some way to really, support those in our community who need it. So, and I'm excited, Senator Benini, to work with you on this, and I'm excited to work with all of you as part of this subgroup.
Great. Yeah, Katie, thanks so much. And all your experience and your research is going to be incredibly vital, and looking forward to it taking lead. And then I thought we'd just everybody go down. Wendell, would you mind being next? And then we'll move to Brett and then to Brian and then move on.
Thank you. Yes, I'm Wendell Alford. I'm in Sussex County, very actively involved with AARP, which is who I represent in this meeting. And I've been a volunteer with AARP for several years, and actually the lead volunteer here in Sussex County. I'm also associated with the BB Medical Center, and I call it Medical Center Healthcare in the auxiliary at the hospital. But I have a special interest in caregiving as well, because in the last meeting, I previewed the fact that I've been a caregiver for the last 5.5 years with my partner, and who happens to be doing really well. So I'm just really interested, and I agree with you, Senator, that we need to take something concrete back for the public or to the Senate and to the legislature, rather than just some thoughts. But we need to take something solid. So I'm all for that. I'm with you 100% in this. I'm excited to be a part of this. Thank you very much.
Great. Thanks, Wendell. And I'm sure I speak on everybody who listened to the last meeting. Your story is just incredibly compelling with your partner, and we're just all incredibly thankful that he's doing so well. Brett, if you wouldn't mind introducing yourself, and then we'll go with Brian and Allison.
Good morning, everyone. My name is Brett Liskey. I'm a registered nurse. I'm the clinical director at Shore Care of Delaware. It's an in-home health agency that does aid-only care. I'm standing in for our president today. She was unavailable. I've been a nurse for 7 years. I still work per diem up at Christiana Hospital, but this is my full-time job as the clinical director of Shore Care. I'm passionate about in-home health. We've had dementia and some issues with aging in our family, and we're a believer that you should be able to age gracefully in your home. Just happy to be here and to be available to any questions of the issues that we're facing right now.
Brett, thanks, and I'm sure you'll be a wonderful resource. Brian?
Good morning, everyone. My name is Brian Bailey. I'm the Deputy Director with DSAPID, that's the Division of Aging and Adults with Physical Disability. Been with the state for 8 years now, in this role for about 8 months. Come from a nutrition and contracting background. I have some background also in temporary healthcare and hiring nursing staff. This issue interested me because after hearing some of the numbers that were put out there through Katie, for one, and the number of millions and billions of dollars across the country that are unspent on caregivers, and the need for them, and if they were to falter, and we would need to lean on our temporary HHAs and CNAs that are already being hindered. I understand the need to, keep the structure strong and help out any way that I can. I am honored and privileged to be here amongst all of you today.
Great, Brian, thank you. And again, it's wonderful series of expertise. I'm sure you'll be a wonderful addition. Thanks so much. Allison?
Hi, good morning, everyone. My name is Allison Brooks. I'm the Executive Director at Silver Lining Home Health Care. I've been with the company about 6 years in my role as Executive Director for 3. And this is, as a skilled agency in the state of Delaware, we provide skilled and unskilled services. And just, caregiving, we've really been focused as a company on caregiving as a career. And that was prior to, we've been focused on that for years. And it just seems like we were on that path for a reason to get where we are today, where it's almost, could be a crisis very soon. And so I'm really eager to be a part of hopefully the solution, at least attempting to be a part of the solution. So thank you for having me.
Allison, thank you. Thank you so much. And but really great team. This is really exciting. We got a lot of really people who are very knowledgeable on the subject. And then you have a chubby Kent County Senator who's willing to help, who's not as help, but he's willing to help. So I thank you all for taking the time to introduce. I think what we'll do now is sort of an open forum, and Katie, if you wouldn't mind sort of jumping in, maybe leading this with your experiences and some of the other folks, but just sort of a talk about what we think as a group are some of the basic core issues, and some of them are obvious, finances, etc. But let's just go around, and Caitlin, if you could sort of pick who's ever raising their hand first. Let's talk about what we personally feel are some of the core issues. I'll start, and I'll say that finances. I mean, that's sort of my bailiwick here in the General Assembly. I'm a budget guy, a capital improvements budget guy, and some of you already mentioned it. And Ed Ratledge does his little scare you to death for the whole committee. I've seen that 2 or 3 times now. But we are looking at a rapidly aging population in Delaware, one of the fastest aging populations, and the financial consequences of that obviously, A, the public side of that, which is, the public finances, but B, perhaps even more importantly, individual family budgets that are being so tremendously impacted. And I would love to have, for this group to come up with some, and I think some other states are doing them and some other countries are doing things that I think are really interesting, a way that we can sort of help folks stay at home when they want to stay at home and support those caregivers at home. If not direct payments, perhaps there's tax policy, there's incentive policies, there's whatever that is. But I think the financial piece, when in doubt, follow the money, right, is going to be a critical component to this. Because the families are facing the difficulties and the potential caretaker is not able to go out and earn income and those kind of things. But B, also the fact is that if we don't support those caretakers, that a lot of those needs will, as he said earlier, will fall on the state, and that's a very significant challenge. So I obviously think that the financial piece of this is a critical piece. And Katie, if you want to go ahead, and we'll let anybody else who wants to raise their hand and share what they think are some core issues, and hopefully we're writing these down as we go. When we are, thank you, Caitlin.
Yeah, awesome. Thanks, Caitlin. No, Senator, I absolutely agree with you. I think that that's a really important component to all of this. When I think of workforce issues or workforce development, I sort of see it as from the professional side, for the professional caregiver workforce, kind of as twofold. So capacity building and competency building. So, looking at how can we incentivize people, build that strong, robust pipeline, incentivize people, to go in recruitment, go into this field, but then retention issues to keep them in there once we have them in the field of the workforce. Also equipping the healthcare professionals with the skills and education that they need. So that being the competency side, how are we giving them those skills so that they can rise up in career ladder? But also, again, around the retention, keeping them in the field. Those I think are to me, the two biggest issues that I see are, again, capacity and competency. But then when we think about family caregivers, I think about what can we do to support family caregivers, whether it's, again, I think the financial side of it is really big, but also providing, education. When I think of caregivers for people with dementia, education is a big part of helping them keep their loved ones at home. When they better understand the disease, they're able to manage the progression of it. They feel more comfortable in providing care. It reduces the chance for an emergency type of situation, but also keeps them confident in their ability to keep their loved one at home longer and provide that care themselves. I also think of support groups, just that they have an outlet to go to. I know DSAPA does a whole lot to support caregivers, which I think is awesome. So, I also think about how can we make sure that, we're doing all we can as a state to raise awareness of those resources that our state already has. That is pretty phenomenal. But it's just how can we make sure more people know about those resources?
Excellent points. Anyone else want to have some ideas?
I would just kind of add on to what Katie said when we're talking about family caregivers, the importance of respite. I think that's the one thing that family caregivers don't realize, that they need until sometimes it's too late. So kind of focusing on that because they're immersed in it 24/7 most times.
Gotcha. And when you say respite, Allison, again, you're talking about
for the actual caregiver themselves. What if it's a husband taking care of a wife, or
right. So someone to come in and help ease that burden.
Mm-hmm.
Gotcha. Fantastic.
I think I saw Wendell's hand up.
Yes.
Yep.
Senator, I'd like to add, I think that's important, and Katie's touched on it too, and that's the training for the individual home caregivers, not necessarily the professional caregivers. And I mean the nurses that might come in from outside agencies and so forth. But I really think it's important. I know when I started and had some home health care at the onset of my partner's cancer, but I had the home health care folks come in for 2 or 3 times. But the most important thing was they really educated me on my home and what's safe, what's not safe, remove rugs, and on and on and on. So I think that safety, I call it safety and training of caregivers and the person being cared for. I think that's important, and I think that's something we should address. And Katie, as I said, Katie's already mentioned it. So, but I think it should be a good core issue.
Yeah, I couldn't agree more. And it's been a few years, but the ARP had an initiative, I think 4 or 5 years ago, that talked about expanding what home care folks could do. And like a lot of things, it ran into a little turf battle for healthcare, issues, and that's going to be part of it, right? That's change is tough, but I agree. The more highly trained and the better trained folks we can get at home, that's the better. Anyone else?
Senator, if I may just add one other thing.
Please. Yeah,
I spoke or trained. I was a driver safety trainer in Delaware for AARP for several years, and
you still have a full head of hair.
Oh, am I? I missed that.
I said, and you still have a full head of hair despite driver training. Good for you.
The summer almost did it. but even seminars, and I'm thinking instantly the thought came to me, but the seminars where we're doing that for driver safety, then why wouldn't you do it for caregiving and have seminars where people could come, even they might not be at that point in their life, but it prepares them for, and probably most all of us are going to have that experience sometime in their life of caregiving.
No, it's a very valid point. Anyone else like to share sort of general ideas I think need to be addressed?
Can I mention that I believe there's I know it's very small and unique, but there's a unique opportunity here for people who become personal caregivers to then branch out afterwards and to stay in that workforce. And I'm not sure if that is what Katie was alluding to when she said to recruit and retain. But we obviously are struggling with our workforce outside of just personal caregiving, but with other outsourced caregiving. And one of the things we could try to do is to utilize the knowledge and the education and the experience of these people, and to have them segue into something more after they've moved on with the personal caregiving, to do it elsewhere. A lot of our caregiving that we support financially comes from peers, people who've done this already, and they go and they repeat this. And if they are under the unfortunate circumstance where they're no longer caregiving because it's been a negative outcome, they can continue on and do this with other people.
No, that's a great idea. Those are, the resources are right there. And Brian, have we had, and you said it's somewhat small, but does that happen a fair amount? And are there ways we can pitch that?
It doesn't, and that's why I was a little bit trepidatious in bringing it up.
No, please. This is open for, please.
So I have heard circumstances where it has happened. If you put yourself in the mindset of a caregiver and things progress, and after years of caregiving, hopefully you've gained a lot of experience, and now you put yourself where you may have lost your significant other. Now what do? You're still healthy, but now you're lonely. What do? So you can become a companion, but look at all of the knowledge that you've gained through caregiving, and you can get paid to do it. I think that we might miss that boat by not making it available to them. People may not even think to do it. And it's right there for them. There was a great story, and I think it was when Wendell was doing his, of a caregiver for the military who had lost her husband, and she's now completely healthy, willing to work hard, but essentially feels lonely and doesn't know what to do. And here's a person who now has all the skill set that she could need to be an appropriate caregiver and to make dollars while doing it. I think that it's a good idea for her. And again, that's why I said it's a unique circumstance, but I think we miss it once in a while.
No, I think that's an exciting idea. And I don't know this, but when Katie was mentioning some of just in the Alzheimer's population, I mean, my guess is there's quite a few folks who have those skills. Whether we see them high profile or not, I think it's an exciting idea.
I mean, Alzheimer's, like Katie said, there are, 20,000 people, I think, Katie? So
20,000, yeah.
think about those people, even if half of them learn the appropriate skill set for dealing with an Alzheimer's patient, how they could utilize that knowledge with everybody else once they're done dealing with their own issue. I'll add one other thing. I think I wasn't involved in this, so but I will take the blame for it now. We might have missed the boat a little bit with, and when I say we, I mean us as a state. We ran a program to pay caregivers, and this is through the adult day program that we have. Essentially, during COVID, it shut down, so we switched a lot of it to virtual, which is great. However, it's not the same thing. People still have a strong cognitive decline for not being in person, and the people who aren't doing it virtually have a strong cognitive decline. And I think that we could have, I'm sorry, let me make my point. We paid the caregivers who now have to stay at home because the adult daycare is not open. So they get a financial payment. That's great. We support them. However, we didn't support them with training at all. And someone had brought up that point, and I think we could have utilized that a little bit better. So I'll have that in mind as I move forward. If we continue to offer respite care, vouchers, things of that nature, how we build it, other than just supporting them financially, but to support them with training as well.
Yeah, no, absolutely critical. Like you said, once someone's trained, they have a chance to transition too. I think those are both excellent points. Thank you, Brian.
Yeah.
Anybody else who wanted to share just sort of some general, what we think are the core issues?
Allison, Wendell, and Brett.
I'm sorry, Allison.
Oh, that's okay. This might, we might loop this in with the finance piece, but as a director of a home healthcare agency, I can tell you that one of our biggest, a big issue for us is transportation. So whether that be via tax policy, or they used to be able to, write mileage, not write it off, but, use it as a tax deduction. And that went away a year or two ago. But that's a big thing, especially in urban areas like Newcastle County. A lot of caregivers don't have vehicles. They rely on public transportation. And then if they're asked to go somewhere else, they could be late, a variety of issues, but transportation is an issue. And in Sussex County, they may be going to two homes that are literally, they may only be 40 miles apart, but it takes them an hour and a half. So it's, I think transportation is something we could look at a little bit.
No, that's a very valid point. And I will tell you, just from the budget perspective, for instance, the paratransit, which it's not perfect and obviously has some challenges, but it also offers amazing services. Let me tell you something, that is a bear financially. I mean, if you look at DelDOT's budget, that is so it's definitely challenging stuff, but you're absolutely right. We gotta get the folks there, and the whole public transit issue in Delaware, especially downstate. I mean, in Kent and Sussex counties, there just aren't that many options, and perhaps we can look at ways of incentivizing, private folks to help fill that gap or whatever that is. But that's very, very legitimate points. Very legitimate points. Great. Oh, there's lots of hands up. I'm sorry, Brett. I apologize. I'm not good at seeing the hands. So
I think Wendell was before me. I don't know if Wendell, you want to go first.
I'm sorry, Wendell. I didn't see the order there.
That's okay. No, I can just real quickly. I think that if you provide to what we were just discussing, but I think it's important from the state standpoint that some type of protection be given to caregivers. When I believe it was Brett was talking about sending people in with the respite care, but I think just in some short discussions recently, someone said, we talked about that very thing about a caregiver just going in and helping someone else. And they said their first thing was, well, who's going to protect me if I do something wrong? Well, not an intentional act, but what if I somehow or another there's an accident? So I think some protection from the state standpoint, Senator, would be something to consider for that. I think it's a terrific idea. I love the ideas here already this morning, but I think it's that there has to be something that has to be recognized as a potential problem.
No, and that's a legit problem, and that can be a heavy lift. You know, the trial bar has some very strong feelings about that, and but we've made some progress. You know, I mean, nothing ventured, nothing gained. So that's an excellent point. Thanks, Wendell. Go ahead, Brett, and I apologize if I missed you earlier.
Oh, no problem. Just speaking to finances, what came to mind for us and something that we typically see is the financial barrier to new caregivers that are looking for employment. And what I'm talking about, we employ home health aides and or certified nurse assistants for our agency. So, I mean, CNA programs, you think of the time investment and the money, you know, like Deltech, schools like that offer these programs that these caregivers need to pay to get that certification. Or home health aid, which there's other options. It's not very well defined in Delaware how many programs are out there, or, you know, the fees that these people go through to get that done. But say, you know, we have someone that is interested in working with us, and they come to us and they need, by Delaware regulations, they have to have like a physical, I believe it's in like the last 3 months. They have to have 2 tuberculosis and skin test checks. That's to make sure that they're not active carriers of TB. They require fingerprinting, background checks, all necessary things, you know, to hire someone for new employment. But a lot of these people, you know, they might not have been working. They have other financial issues going on. And these little, you know, requirements add up. You know, these are costs that they have to get done for us to employ them. So what we have done in the past is, you know, we try to, you know, get a good feel for, you know, certain people that are applying and financially help them out with that. But then we as an agency has also gotten burned because, you know, they might, whatever reason, you know, did the TB and did the physical, but then they had a bad background check, or they decide they don't want to be a caregiver. And now we just lost that cost. So it's not something that we just like to do all the time, but, you know, we do try to do what we can to help people get to where they need to be so they can be employed. You know, it's just a challenge out there. Someone had mentioned transportation as well. I know recently, you know, of course, like with gas prices going up, you know, we do pay small travel time between clients, which is like a smaller amount than like their hourly rate. But just for some people, I know we were looking for coverage for a client, I think that was in Middletown, but the caregiver lived down in Dover. And, you know, they were reluctant to drive that far, you know, for the gas prices. You know, so that's something we also try to, you know, we'll give them small little bumps in pay to, you know, hey, can you get down there? I mean, really, it works out for everybody, but it's little things like that that can be the barrier. You know, if we don't want to go the extra mile and try to absorb that, you know, extra gas price that's going on right now, you know, that's the breaking point for some of these caregivers, because financially for them, you know, they don't want to, you know, spend that extra money to go down there. So just some of the challenges that, you know, we're facing.
No, those, I'm glad you brought those up. We've had that discussion, and I apologize, folks. I'm obviously putting everything into my world, and please, you know, there's no ego to bruise here, so interrupt me if you like. But I will tell you that in the legislative hall, we've had the discussion about those very kinds of fees and other training programs. You know, whether it's getting folks back into the construction trades, for instance, which is a critical need, and I believe we actually have had some programs that help get that done. So I think that's actually might be fixable. So I'm so glad you brought that up and that we got it written down, because that's one that may not be that heavy a lift financially for the state, but could be, you know, very, very, very helpful. So I'm so glad you brought that up, because I'm pretty sure that we have done that in other areas of critical need, where we have said we'll help absorb the background cost, which I know is, first of all, not cheap, but secondly takes forever, and some of these other things. So I'm super glad you brought that up, and that one I think is something we may make some short-term progress on.
Yeah, and I would say too, Senator, that you know, it might be interesting to look at, and I'm sure the data, or we can gather the data if it's not out there, is the cost savings for the state. So investing in a program like that will allow people to remain in their homes and communities of choice for longer, in the long term will save the state monies if it's reducing institutionalization or placement in a long-term care facility.
Oh, absolutely. And quite frankly, one of the reasons, obviously the humanitarian side is most important, but one of the reasons I was drawn to this subgroup is for that exact reason. I mean, I think supporting caregivers at home, if at all possible, there's just no question that that's going to be the better thing to do in the long run, not just, you know, from a family perspective, but financially as well. So, Brian, go ahead.
Yeah, back to what Brett was referring to and what you were referring to. I agree with everything regarding paying for, you know, the licensure, for the testing, for the upfront costs. But I've watched programs like that fail, and they fail because there's not, in my mind, enough financial backing behind an appropriate growth track for a person. It's an easy idea to you know, grab students out of high school that don't want to go to college and to begin them on a clinical track, you know, where they can go HHA, CNA, LPN, and right up the track, right through Deltec or whomever. But I watched a home health provider try to support this on their own. And just as it was just alluded to, they get into the training, they get through the training, and then they start to say, you know, this pay is not very good, and this is a very difficult job. How long am I going to be doing this before I get paid more and before I do something different? And that particular provider, you know, couldn't support any of that. So if there's a way to, I'll say dangle a carrot, even though that doesn't seem appropriate at all. But if there is a way to show them, I have this great personal story for, and I won't say who it is, but I know a person who was a CNA when they were younger, and that's a great thing. You know, I could never do it personally. It's a great, great thing. But that person moved up the ladder, and now they are one of the, I'll just say, the highest ranking clinicians in our state. And they started as a CNA, coming from outside of this country with no background whatsoever. The potential is there, and somehow we need to show people the potential that if they work hard, and that if we can financially support them while they're going through the educational process, hopefully support them a little bit more while they are being a caregiver through being a home health associate or CNA or whatever. We can keep them in the pipeline, so to speak, a little bit longer than simply losing them, because these programs, I've watched them fail time and time again because they only go halfway. They don't go the whole way.
It's a very valid point. It's very helpful. Thanks, Brian. Exactly right.
Yeah, I mean, like I think about, you know, not only the importance of supporting financial incentives to get folks into the pipeline, but then also developing career growth opportunities while they're already in there to maximize the existing workforce. Thank you. Good points, Brian.
Good stuff. All right, these are great ideas, guys. Thank you all very, very much. Anybody else? Just sort of general discussions of some of the things that we should talk about. And Caitlin, my eyes are terrible. Would you mind reading what we have so far? My middle-aged eyes, Wendell, are with you. That
Sure.
agenda, a little green box, let me tell you.
So for our core issues, we have finances, both on the public side and also the individual finances. We've got some notes about tax policy and incentives, the investment that HHAs and CNAs need to make in order to get into the career. So the physicals, TB tests, fingerprinting, background checks, you know, all of these costs are a barrier to entry. If agencies subsidize the cost, they may lose out if the applicant doesn't make it all the way through the process. And to Brian's point that he just shared, you know, how can we provide more financial support to keep people beyond just, you know, that entry level? Our next core issue is the professional caregiver workforce. How do we build capacity and competency? So recruiting and retaining and providing skills to advance up the career ladder. We've got family caregivers, providing them with education. For example, when somebody's caring for somebody with dementia, support groups, raising awareness of existing resources in the state, the importance of respite for caregivers, safety training, which was Wendell's point. Then we have personal caregivers, how do we tap into the skills and experience of personal caregivers who, you know, may have lost their loved one that they were caring for, but still have the ability to help other people. Transportation, all of the things that go along with that, how costly paratransit is, gas prices being prohibitive for caregivers. We used to be able to deduct mileage, but can't do that anymore. A lot of caregivers don't have vehicles, have to rely on public transit, which takes forever, especially downstate. Protection against liability for caregivers. And Katie made the point about cost savings. So to the extent that the state can help people remain in their homes and have that caregiving in that setting, we're saving money that otherwise would be going to institutionalization, which is way more expensive.
Oh, that's great stuff. Those are all really, first, thank you guys. This is really, those are all incredibly important points and all certainly worthwhile. I did have a question, sort of a question to the panel, if you will, on, we had talked about the financial incentives for training and everything, and I think that's fantastic. And Brian, if you have very specific ideas on that, you want to go offline, I'd love to talk to you about it, about what you think that long-term looks like, because I couldn't agree with you more. And Wendell, not to pick on you, but because of your recent sort of personal experience, do we have, and Katie, you probably know the answer to this, do we have any either direct relief or tax relief or whatever for folks who are at home, you know, caregiving to their spouse or I mean, does the state involved in that at all? Do we know? Or is that because I know some other states have looked at that, trying to create some incentives to help folks stay home and take care of their loved ones. Are we involved with that at the state level? Does anybody know, particularly whether we have any programs that help with that?
I'm not aware, Senator.
Yeah, and I'm not either. I know I had a discussion with the ARP, you know, at this point 5-6 years ago about some of the things that are out there, but I just didn't know if anybody had any personal experience with that, because I also think that's, Katie, to your point, that's money well spent, right? That's an investment that saves first of all, does the right thing, but secondly saves us a lot of money in the back end, and that's exciting stuff. So okay, well that gives us a great sort of a general idea, and Caitlin, you'll be getting this to everybody, so thank you. That's a great thing to sort of work with. We'll clean it up a little bit, make sure everybody gets to it. And I apologize, I said this a little before we officially started, so anybody needs it, and if I'm repeating myself, please forgive me. My goal, and you know, I'm just trying to help facilitate here. So if other people have other thoughts, let me know. But my goal would be to get to 3 or 4 at the most core, let's do these things and push real hard for them, versus, you know, 7, 8, 10, hey, these are all really great ideas. Because I apologize if I'm repeating myself, because when it gets to my building and you give us a list of 10 recommendations, we'll take the 2 easiest and then say, oh, look at us, look how great we are, right? It doesn't mean those 2 aren't important and it's not progress, but my experience has been short and sweet and right to the point, and push for those, and you have a chance to really, you can make some really meaningful change. And if you don't give legislators a menu, that's the best bet. I think that's again, that's just my experience. So when we send these lists out, if you could sort of, all of us sort of as our homework, sort of think about how to consolidate those into those three or 4 core categories that we really want to push for, that would be great. So that's let's keep that in mind. I guess the next on the agenda is discussion of subgroup expectations and timeline. I guess I sort of unintentionally already started that, but Caitlin, if you could tell us sort of what the official timelines are, and then maybe we could open up to the group with what everybody's expectations are, and simply go through each member and see what their expectations are.
Sure. Also, I wanted to flag Wendell's got his hand up.
Oh, I'm sorry, Wendell, I apologize.
Who went to the doctor this morning? You?
Yeah.
I have an extra set of glasses. I'm just kidding.
Yeah, that's right. I might need them.
I'm only kidding. Just a thought. When we started the Aging in Place meetings, Will had sent out a questionnaire, and we all had to rate 1, 2, 3, 4. And I wonder if that's what we could do with this list that we started today, is maybe when it's sent to us through the mechanisms of the state that these how to do these surveys, but maybe then we could each choose our top or number 1, 2, 3, 4 and see how we are together as a group.
Oh, that'd be great. Caitlin, can we get
Just
that
a
done?
thought.
No, it's a great idea. Thanks, Wendell. Let's do it.
Thank you.
So Katie, if you go, once you go ahead and start and sort of talk about what you think, Caitlin's going to tell us the official timeline, and then maybe you could tell us what you think the application should be.
Sure. So I believe the overarching working group has to have a final report to the General Assembly by March 31st of 2022. So that gives us really just about four months to complete the work. And I know that Senator Mansavinos would like for each subgroup to meet at least one time in between every full body meeting. That way there's, something to report out. The next full body meeting is actually going to be next Monday, the 22nd. So we're going to actually post notice today for that meeting. Beyond that, I don't know how frequently Senator Mansavinos wants to have his meetings. I think we were aiming for about once a month, but at this point, it's kind of hard to tell because each subgroup, including this one, is just getting off the ground.
Yeah, so, and I actually checked in with Will about this.
Oh, great.
So that I could recommend something that was in alignment with the other subgroups. And what he recommended is about every 3 weeks, it seems to be, is when the subgroups, or the cadence of when the subgroups are planning on meeting. So if we were to look at 3 weeks, Will suggested we look at sometime the first week of December for our next subgroup meeting. So maybe Caitlin, working with you, and I'd be happy to help too, pull it together. We could send out a survey to figure out the best day and time. If we look at that first week of December, that would work for the majority.
Absolutely. So we'll be sending out 2 surveys then, one to rank the priorities for the court issues, and then a second one to schedule the next meeting. And it looks like the first week of December starts on a Wednesday. So December 1st is a Wednesday. So let's see. Yeah, okay. So we'll look at those dates. I'll do a Google poll.
Great. Okay. Thank you. And then I'd sort of talked about what my expectations were, that hope that we could end up with 3 or 4 sort of hardcore recommendations that we could push, either through the executive or the legislative, or other forums as well.
Mm-hmm.
Kate, what would you like to see? What would you like us to see us push for in March?
Yeah, ditto. So I would love to see 3 to 4, really solid, tangible recommendations that we can push incredibly hard to get this done. So I wholeheartedly agree with that. The other thought that I have, so I'm a big proponent of using data to inform policy and recommendations. And so I'd just be interested, and this is something perhaps we could bring forth to the next meeting, is just what do we have that's already out there that might help to back up or inform our recommendations as it relates to the workforce or even family caregivers. I'd be happy to do my homework on that and bring what I know is already out there, including what efforts are already being done in our state around workforce. But then also, in my role with the Alzheimer's Association, one of the greatest things of being part of a national organization is that I can look to my colleagues in other states to see what they're doing too and pull out some best practice ideas. So I can do that as well and bring that to the next meeting so that we have, again, some data to really back this up, what we plan to recommend.
Oh, that'd be fantastic. That'd be fantastic. Anybody else on sort of what you would like to, sort of what our expectations are, what you think realistic expectations and what our goals should be? I know we've already sort of talked about it. We're sort of rehashing things. So, okay, well then I think we're moving ahead. This is great. This is going to be a 1 hour meeting, not a 2 hour meeting. Caitlin, do we move on to public comment? Would that be the best use at this point?
Yes. So at this point, if anybody in the public would like to make a comment, please use the raise hand function. Okay, and I see Verna Hensley has her hand raised, so I'm going to unmute you. And Verna, you should be able to speak now.
Hi, good morning, everybody. Can you hear me okay? I'm Verna Hensley. I work for Easter Seals. We offer really so many of the services you've been talking about this morning and have been for many years here in Delaware. The thing that is just an incredible, I didn't prepare any comments, but it was an incredible discussion this morning, and I was talking to my cat here, and you were basically the next person would, make the point that I was making to my cat here. The only thing I would just emphasize, and it gets back to Brian, something that you alluded to, and you too, especially Brett and Allison, is we absolutely have to start dedicating more state and federal resources to the workforce. And I can tell you, I'm most familiar with our intellectual disability services workforce, but it's a very similar workforce, right? The direct support professionals are also critical, as well as the CNAs, and as you all alluded to, there just are not the adequate wages to draw people into this this work and to keep them and feel they have a career path going forward. And I will just tell you, it just comes from years and years of really neglecting to attend to those the funding that feeds into those wages. And up until this year, the support for a direct support professional wage by the state was $9.50 an hour. We lobbied very hard to get some funding in the intellectual disability side of things, and now it's moved up to 12 starting this year. But you can see that's already outdated. And I think it really, that has to be a part of this conversation. You can't create a thriving workforce if you're not willing to pay the wages to keep them into the system. So that's my main point. Obviously, respite is another critical need. If you get that continuum of care provided, where the person doesn't immediately have to go into a nursing home or an institutional setting, you're extending that for as long as you possibly can through a variety of services. It can be and maybe it's at home, attendant care for a period, and then then maybe it's a day center, but you're still for every month, week, whatever, you're extending that care in their home. You're saving an incredible amount of money, and you're obviously serving them in the environment that the majority vastly prefer to be served. So yeah, that's just my 2 cents. And, I think this is a tremendous subgroup, and I really look forward to tuning in to the next time you guys meet.
So I have 2 quick questions for Verna. The first question is, how did you escape not getting on the subcommittee? We'd love to have you. And then the second one, and Brett, I'll go to you, Verna, if you don't mind. Obviously, the salary, the straight up money, I get that and understand that. What else is there to help incentivize people to get to stay in? And I know, Brian, you talked about this as well. Are there other, and there may be an unfair question, you could say, we'll talk to you about it later, that's fine. But what other, so obviously the money's the big one. Is there other things that we could possibly look at to help incentivize folks?
I think creating that, and whether it's, a certification process, and I'm talking the unskilled support workers, right? I mean, and Brian, you can speak, more directly to, or Brett, to, the other, those that do require some sort of more formal certification. But I think I think it's that opportunity to create some sort of a career path. And I would leave that kind of to the experts. You know, Allison, you're shaking your head, and Brett, I know you could comment as well. I think so many people are drawn to this type of service. It's part of who they are. And thank God for them, because they're the only ones we're managing to hold on to. I mean, we have 46 openings for direct support professionals at Easter Seals now. That's unprecedented. And even though we've bumped up wages, you know, it's just hard to draw people in. And then if you do manage to draw them in, you know, if they don't see that opportunity to go to that next rung of the ladder, which it can happen, but it's just not really evident. That path isn't really evident. So, but I'll defer to Brett, because I'm sure you have some experience in that too, Brett.
Yeah,
Thanks.
and I just want to jump on that too, Verna, because I couldn't agree more. I think it's that career path is incredibly important. And I also think about skills building and training. You know, speaking for the population of people with dementia, we found that when the workforce is trained in dementia capable care, it actually improves their job satisfaction, because they're better able to relate to the person that they're providing care to, better able to manage the behaviors, the symptoms associated with the disease. So, you know, I think that's a critical component to this as well, is that, again, the competency building, investing in that skills building, career pathway, training. You know, that's, I think, also an important part of job satisfaction and retention. Sorry,
Yeah,
Brett.
excellent. Thanks, Katie. Thanks, Verna. Brett, go ahead.
I was just gonna say that was really well said, Verna. Just in the
Verna rocks. Verna rocks. No
um,
questions.
just want to say, kind of in the greater whole of just, I think what Delaware really needs, and just kind of healthcare in general, is to really just reevaluate the value of, you know, an in-home caregiver. And I know we mentioned it earlier, and that there's been studies done that show, you know, the value of, you know, staying in your home and not being institutionalized. But, you know, something that we see very often, it's not necessarily, you know, and, you know, people need respite and things like that. But sometimes, you know, we have caregivers that are in the house, the families in the other room in the office doing a Zoom meeting just as we are right now. And they need that caregiver in there to, you know, to work their profession and do their job and support their family. And it's, you know, there's a lot of unseen value that's going on. You know, I feel like that's probably, I don't know if it's hard to put into data necessarily what you're getting out of it, other than, you know, the hospital costs. And, you know, you don't want somebody just to drop their family member off at the ER because they need to, you know, go to work that day to make sure they don't lose their job. It's just something that's, yeah, it's something that we hear, and, you know, it's just hard to kind of put, you know, a data point on. But yeah, one of the challenges that I think we all need to be aware of.
And just sort of I'm getting a sense from everybody here that, you know, these are incredibly important jobs, and we should be appreciating them more. And perhaps we need to look at policies that, I mean, appreciate's not the right word, but really acknowledge how, you know, important these are, and these are good careers, et cetera. Brian, go ahead. Thank you.
Just wanted to respond to what Verna had said, and I'm not saying anything that no one here knows, but we'll just put it down. Easter Seals is one of many of the providers, tremendous providers we have in our state. Every single one of them calls me with the same problem. She has 46 or 48 people that she needs to hire right now. None of them, she's getting no good cert list for someone coming through the door as a activity or physical therapist for $13, $14, $15 an hour, when they can go to a fast food chain paying a bonus and doing work that is 10% as hard as what you ask of someone who has to go out and work with a caregiver or with a person who needs caregiving. One other thing struck me as someone was speaking, and it will, I hope, hopefully, but I'll go back and double check, it will be handled in one of the other subgroups around law and legislation. There are some, what I felt, antiquated rules regarding who can become a caregiver or a licensed CNA in our state. And I believe that's going to be handled on the other work group, but I will double check on that. Even that slight alleviation of allowing some additional folks into the workforce might be helpful.
Yeah, the turf battles are in Delaware. It's an issue. Let's just leave it at that, to other. So, but okay. Well, and are there any other public comments, Caitlin? Or
We have one other member of the public in our attendance list. So if you would like to make a comment, please raise your hand now.
and thank you for attending.
Yes, I'm sorry if you're hearing background noise. They're doing a lawn care today outside my house. Okay, it doesn't look like there are any other raised hands. I would like to note quickly, though, that I believe you're right, Brian. The financial and legal barriers subgroup is actually having their first subgroup meeting right now, beginning at 11 a.m. And so, of course, all of these meetings are recorded and are available on the Delaware General Assembly's YouTube channel. So, you know, at any point we can all go back and watch, you know, what the other subgroups are doing, and of course also tune in to the meeting next week for the report out.
Great, thank you. So just a real quick, if anybody wants to get a hold of me, the best way is my mobile phone, and a text is a great way to get me, because, you know, as all of you know, life is one meeting with occasional breaks. It's my mobile is, you're supposed to include the area code as of October, right? 302-270-2428, 302-270-2428. Texting is a great way to get me. I do get back. Sometimes it takes it a while, but anybody has any particular needs, or talk to me, or hey, Colin, I got this idea, you know, what, you know, please don't hesitate. And by the way, guys, I am so impressed with this panel. Caitlin, these awesome. I mean, just an amazing group of professionals with an amazing experience. And I am, it's an overused word, right? But I'm really excited. I mean, I think this group is going to come up with some really great recommendations that will be achievable, which is the key point. And I'm very excited about it. So, and Caitlin, please correct me if I'm wrong. Katie, please correct me if I'm wrong. But I think the next steps then is we're going to send out sort of the summary of ideas and the notes and everything. We're going to have both the survey and also try to figure out when the best time to meet is in early December. And then in the meantime, Katie, maybe you and I should get together offline as well, just sort of talk about what you think is the best way to do this, you know, and that way we're together in case one misses or whatever. That it'd be great if we get together. And then in the meantime, we're not going to meet for 3 weeks, but if folks have other ideas or anything, let's do that. And we're going to try to, and Caitlin, we'll try to get those lists out to you as quickly as we can. And please, guys, there's no ego to bruise here. So if you're like, hey, we missed this, or gee, I wanted to mention this, and I would have loved to add this to the list, do it, right? You know, and I think, and then we'll just start working on the hard part of getting it down to that sort of a achievable list. And the other piece is, if you have, and Katie already volunteered, thank you, Katie. If you have data or illustrations that you think would be helpful, not just for all of us in the subgroup, but it also you think will helpful, how to say this, to make the case when it comes time for us to push to try to get some of these things done, please share that with the group as well. And then what if anybody has any closing remarks, or Caitlin, did I miss anything, or Katie, did I miss anything? Let's, we're all good. Well, guys, for everybody, thank you all so much. I think this is an amazing group of folks who we're gonna come up with some really good ideas, and we're gonna push and get some stuff done. I'm genuinely excited, and I've been in this building a long time, so I don't get genuinely excited that often. So this is a good thing. So, all right, well, folks, thank you all so much. I'm sure we'll be in contact in the meantime. And then Katie, if you and I can maybe grab lunch the next week or two. And Caitlin, thank you so much. By the way, a hand for Caitlin, who pinch hit this morning. She did great. Thank you, Caitlin.
Thank you.
Folks, thank you all so much. And then Verna, we're going to get you on here somehow. I don't know how we're going to do it. We're going to
Okay.
By the way, I played basketball. I played basketball with Verna's nephew years and years ago in college. So, so all right. Well, folks, thank you all so much, and looking forward.
Thank
Thanks
you.
for having me.
Thank you. Bye.